Hey, everybody. Welcome to the Dental Handoff. I'm Dr. Kelly Tanner, and today I have one of my besties, Nicole Fortune. You guys probably know her. You guys have seen her around or work with her. Nicole, welcome.
Hi, thank you.
This has been a long time in the making. We have been trying to get our schedules coordinated. I'm so glad you're here.
Yay! Me too. Me too. I'm looking forward to it.
Yeah, so I've been working in the background with Nicole for a while with Young Innovations, and she's got her cool story to tell us about her journey in dental hygiene and where she's at today. So, Nicole, question we always start with is why dental hygiene?
Well, it kind of picked me in a way. I was working. I'm older. Yeah, I'm in my 50s, and I started out my working journey working in business, working for a gentleman named Michael Milken, who those of us who are old enough to remember go, "Hey, that's a name that I remember, and I don't think it's a good one." No, it's not a good one. It was he was in the went to jail for selling fake or junk U.S. bonds, so he was not the most upstanding. But I started I started out in that kind of a world, but that was in New York City. Had was working here from home in Vermont, but working for him remotely even in the mid '90s, which was really rare, from Vermont, and then all things kind of collapsed, of course, and uh, couldn't needed to find a job, and my mother knew someone who worked in an endo office, and I started assisting in this endo office, and it was the perfect office for me because I was in my mid 20s. It was all female dentists, female staff. No offense to our male colleagues, but it was perfect for me at that time in my life
Mhm.
because it was very empowering. I moved on from there and went to assist in oral surgery just because endo, I mean, is a little was I found it to be a little
Slow.
dull. so so um, I, I moved on to oral surgery with a practice of 5 doctors, and it was roller skate time. So I learned a lot, and I had a lot of fun, and I just got to see some cool things. And one of the doctors there said, "Hey, have you ever thought about going back to school?" I had a degree in psychology. My bachelor's was in psychology, with a focus in organizational psychology. And I said, "Well, I hadn't thought about it, but maybe." And so went to talk with the director at the hygiene program. I found myself in school that following fall at the University of Vermont. And when I graduated, I then went in right into perio, which was awesome from my oral surgery experience and then into perio. So everything's been in the specialty realm.
Yeah.
And lo and behold, I really loved it. So that worked out great.
What do you love? What did you love most about the specialty realm, do you think, kind of looking back on it?
I I really liked the hard cases. I mean, I like my patients. It was cool, most of them, right? Wink, wink. But it was cool to get to know some of them and to earn their trust and whatnot. But I really liked the complexity of the cases that I was
Mhm.
seeing. And because I had the history of assisting, I offered to assist my periodontist while I was waiting for my license to come in, and that worked out really well for him, because, he could shuffle and move around different rooms, gave him an extra assistant for a while, but it worked out better for me because I got to learn how he thought and
Yeah.
how he analyzed different cases, and then I could learn where he thought we were gonna go next and why with those patients. And so I felt like it made me more effective as a hygienist when I was treating patients, knowing where his mind was and how he would approach the disease, the disease management. So for the last I was there for almost 20 years, and for the last 10, all I saw were scaling and root planing all day. Um, yeah.
Did you I when I first started working, I worked between a general dentist and a periodontist. And then I was his first periodontal hygienist doing all of his scaling and root planing. I'm sure you experienced this. I was getting ready to ask you the question, but I know that you had to have experienced this. The cool thing of doing an SRP and then them flapping it and seeing where you missed.
Yeah,
Did you
or
get to
being
see that? Or
or the
bad?
really right, or being called in, right? Like, "Doc needs to see you in his operatory." "Okay, see this?" "Yeah, I see it now." So, yeah, it was eye-opening. Was more eye-opening to me was when I started using a dental endoscope. And
Mm,
being able to see how my instruments truly adapt to the tooth. Because you talk about using the tip third of your instrument and you're thinking, well, tip third's like this big. No, tip third is like, it's like this teeny, teeny, tiny little bit. And
slice.
so it's a tiny, tiny little bit. And understanding, how to adapt yourself to the line angles and where the common places that everybody was missing, including myself, and how long it took to get calculus off the root structure. I think that if people learn nothing else from listening to someone who's used an endoscope, but to understand the amount of time, don't just spin through there with that piezo or that ultrasonic. It's not a quick, 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 quick thing. It takes that back and forth motion to be able to remove it and remove it effectively. So that was a huge eye opener. Of course, the best part is when they come back and things have healed. They're in better health. You have patients that believe it now because perio didn't hurt before. They always had some kind of buy-in by the time they came to our office
Right.
because the you guys in the restorative world have done the heavy lifting of convincing them to come see us. But they get it now, and there's no more bleeding, and their home care is better. And or even some of the folks that were diabetics and were having trouble regulating that. And now that's a little bit easier for them now because that disease process has been halted. That is absolutely priceless.
In your opinion, I'm gonna ask you a really dorky question.
Do it.
You know how we learn in hygiene school, like, after 5 to 6 strokes, your instrument's dull? Is that true?
I think
Depending on the instrument.
it depends on the instrument. It depends if it's brand new, and it depends on how they're using it. But I think so. I honestly don't utilize hand instruments as much as I used to, and I think that seems to be a trend for a lot of our peers. Is that we are utilizing our ultrasonics or piezo instruments. More and leaning into those guys more, and helping to save our wrists, helping to save our backs and our fingers, and we're not needing to stroke so heavy so often with those instruments.
Yeah, I was just curious because I'm thinking with the endoscope, I've never worked with the endoscope, so I'm fascinated by that and being able to see it while you're instrumenting, if you noticed a difference after a certain number of strokes.
Yeah. Yeah, I get you. No, I didn't notice it so much when I was seeing. I mean, you can feel it obviously, almost immediately. But the thing that was the most eye-opening was the different instruments and adapting them to funky root structures and these different nooks and crannies that we don't see or necessarily feel, because it's magnified on that image. So you're
Yeah,
seeing that and you're like, okay, so this is how I got to get around that that internal part of the root of that furca, how I'm really not getting
yeah.
it necessarily with the instrument that I think I'm getting it with. And it's all about adapting and just like using your 13, 14, kind of on the linguals of the mandibular interiors and that little notch, or using them in interesting ways. That's what I found really interesting.
So advanced instrumentation beyond hygiene school, for sure.
Yeah. Yeah, yeah, definitely, definitely,
Let
for
me just find
sure.
the cutting edge first. Okay, which do I have the right end? Is it shining back at me?
That's right, that's right. I kept and hearing, my Leslie Hills, my perio instructor, who I have the honor of working with on Tuesdays when I'm in the hygiene clinic, and I can hear her voice all the time, even to this day, "Turn, turn, turn. Turn the instrument before you have to." Like, so constantly, "Turn, turn, turn," when I'm up there with that endoscope, "Turn, turn." It's so funny.
Like, before you go around a corner, you take your foot off the gas a little bit, if it's like a really sharp corner, you're like,
That's
"Ah."
right, that's right, that's right.
That's That's such a cool path, and so you went from a specialty hygienist, you're still teaching at the school now, and tell us what else you're doing.
Yeah. So, I mean, I work with young, as you had said earlier. I'm the clinical education manager there. I get to work with Lauren Kanzing underneath her, which has been amazing, and help develop educational materials that will also introduce people to different products or services that we have. Getting involved with the marketing teams. That's it's been a lot of fun to lean into my hygiene education in a different manner. I also, yeah, I'm at the school. I'm at the in the hygiene clinic. We have a 3-year program. This year, I'm with the second year students, but usually I'm with the seniors or the third years. And I get to. I brought all of my fun equipment with me, so the endoscope is living there. My airflow prophylaxis is living there. They have a laser as well, and so I spend some time introducing the students before they graduate to kind of newer technologies and other things that they may find out there. I also teach laser courses as well. I'm an Academy of Laser Dentistry trained um, laser user for Nd:YAG diode and CO2 lasers.
Yeah.
I find myself in my little state of Vermont, a lot of offices introducing laser, going in and helping them not only learn how to use it safely, but also how to integrate it into their practice and what makes sense in terms of how they communicate to their patients and how they're going to lean into that technology. And I do some speaking. I've done some different speaking on the stage at RDH under one roof and different areas about periodontics and lasers and endoscopes and all of that fun stuff. Um, a lot of talk about dental implants as well, and how to approach those, not just with the actual how we're going to instrument around them, but my biggest thought and my biggest the hill I will die on is that we don't evaluate implants quite as closely as we need to during our hygiene visits.
Agreed.
So yeah, we go through. And this is no reflection of my school because I know that this is not them. Back then, we didn't have a lot of people coming into the clinic
Yeah,
that
we
had
didn't
dental
know,
implants.
and we just didn't know what to do.
That's right, that's right, but I was kind of in that polish and pray kind of mentality. So you just I didn't wanna hurt it, I didn't wanna scratch it, I didn't want it falling out of the patient's head, so, I just looked at it, polished around it, and just, hoped that everything was fine. But what we know now is that we need to pay much closer attention and, not only to the current status of that implant's health, determining how we're going to proceed with that patient, but also what are the risk factors for that
Yeah.
area? Because remember, periodontal disease is not just patient specific, tooth specific, but very much site specific. So when we're looking at that implant area, what are the potential risk factors in that area and how can we minimize that risk and how can we instruct our patients to do the same?
Yeah, and the restoration around
Yeah.
I mean, the implant just by itself is easy to keep clean. As soon as you store that sucker, you need a air flosser. I don't care who you are.
That's right.
You need it, and you cannot keep anything out from under. Do you have an implant, Nicole?
No, nope, nope, nope.
I
I
didn't
have,
know until I had number 3 what the
yeah.
and how it meant it's just
So you've
yeah,
got
it's the
you've got
care
some
of it
too, yeah, you've got
because it's
some,
bulbous, right?
yeah.
It's bulbous, it has to be to take up that space, and you can't there's no keratinized tissue to hold that tissue up against it, and so what holds it? Food.
Yeah, right?
Everything,
Exactly,
blueberries,
exactly.
I mean, you name it. It seems
Yep.
like water gets hung under there.
Yeah. Yeah, I've had patients come in and actually say, "I think there's something wrong with this implant because the food keeps getting trapped around there." And, those wide emergence profiles can be a real bugger. People have to take a different approach in terms of how they're going to care for it. And I've had patients kind of, I don't wanna have to get, a special sized interproximal brush just for this one area." But dude, you've been through a lot with this one spot. Let's maintain it appropriately. But yeah, those wide emergence profiles, I think the studies show that if it's over 30 degrees, that it really, it can be very, very food trapping. And therefore, if it's not cleaned out well enough, well, we know what the cascade of events are, right?
Yeah, even with a healthy patient.
That's right. That's right.
So that's quite a portfolio of things that you talk about. I have another question before we move on. There are a
Yeah,
lot of
sure.
hygienists I talk to. This is this is kinda like the ask me anything.
Do it. Ask
So
me
young.
anything.
There are a lot of hygienists that are like, does bacterial reduction with a laser really work?"
Yeah, sure. So
Put you on the
My
spot.
laser people don't come for me. So I live in a state where I can't curettage. I think that's one of the beautiful things about lasers is that they are able to target just the diseased epithelium and pulling away diseased epithelium while leaving some really healthy connective tissue behind. We can't do that with a blade. So the blade of our curette, if we were to curettage, is just going to take whatever it's going to take with it. So lasers are very, very selective. I can't do that. I think that that's probably one of the biggest benefits during scaling and replanning. As a matter of fact, Dr. Lau, when I heard him speak years ago, used to say, if you want scaling and replanning to work every time, bring back curettage. And then I think he said, "Get over it." That was the next line, because he was talking with a group of dentists, that
Mm.
that's really what needs to happen. I can't do that in Vermont, so I am gonna answer your question. What I can do instead is I can set my and what most of the states can who do use lasers can do is we can set our lasers to, emit a pulsed level of energy, which saturates and goes a couple of millimeters into the soft tissue, a couple millimeters into the dental tubules. And yes, if a gram negative microbe is in that path, it will, vaporize it. It's attracted to those gram negative microbes. But also, what it's doing is something that nothing else can do, and that's photobiomodulation. That is sending light into that space to help to encourage healing. It's activating the mitochondria, the powerhouses of our cells, and revving up RNA and DNA turnover. It gets me very excited because I personally feel in the hygienist's hands, especially those who cannot curettage, the true value of lasers is in the promotion of healing. And that's like I said, that's not something anything else can do
Well, that's
that we
kind of
have,
like the definition of what a hygienist does.
right?
We
Oh my
promote
gosh,
healing. When
we
you said
promote
that, I was
healing.
like,
That's exactly. Exactly. So I feel like that's the biggest benefit in our hands. The other big benefit that I tend to mention that sometimes I get a little groan for is that patients say yes to treatment if they hear the word laser. I think that was probably one of the biggest benefits in our office was that they equate it to like laser eye surgery, which has, a reputation for being fairly, modern, minimally invasive,
successful. Yeah.
being in kind of a new answer to an old problem, right? I've been dealing with it's chronic, but now we have a laser. So all those things tend to get patients who are hesitant to say yes to treatment. It gives them more of a sense that they're going to be well taken care of, and they'll do the treatment.
The confidence and the trust.
Correct.
It's
That's
building
right.
that.
That's right.
Yeah, that's interesting because I think that I've been in offices where I'm consulting and I'm just kinda reeling back to this. There's some hygienists who are trained in it, but they're just thinking of it as another moneymaker for the practice, but
Mm.
it's like, where first of all, the setting for your laser has to be, kept up and make sure that it's effective and all of those things that you're making sure of with that, and that your technique is how it needs to be, and you're using the right pulse for the right situation. But there are a lot of hygienists who just think that it's gimmicky, and so I was just curious about what your take was with that. Just
Yeah.
material reduction, not even like with SRP, but just a person who has localized gingivitis or who has generalized gingivitis.
Yeah, I used to use it on all of my patients after I was done scaling and root planing, especially if it was a kind of a fragile case or there were implants involved in that case. That was part of their maintenance. Every single time they came in to see me, I would fire up that laser. And I had one patient, she's sweet. I live in Vermont, so I got a lot of hippies here, right? Ben and Jerry's, you get it, Bernie. But so we got a lot of Birkenstocks and hippies, but she's a sweetheart, this wonderful, wonderful lady. And she used to say that using the laser during her cleaning was magical. It felt like magic to her. And it makes me giggle, but it's also, um, I think that's a pretty honest, statement from her about how that can sometimes be viewed by patients, is that you're going that extra mile. People who don't believe in it haven't done enough research to really look into at least the photobiomodulation piece. And it's always going to depend on debridement. So we always have to come back to that. Nothing is going to be successful, whether it's a subgingivally placed antibiotic or a laser or anything else, unless we debride enough for that specific patient's immune system to stop it, to break that cycle of destruction,
Right,
right?
right.
So it's all about the debridement. So if you're not getting good results with your laser, look at your debridement. The
Mm,
laser is going to be an adjunct. It's not going to be the thing that fixes it, if you
right,
will. It's
right.
going to always be an adjunct. Um, so the reason I feel so strongly about the photobiomodulation is use that diode laser that they're using, which I'm assuming is what they're using, and you use it on like a herpetic lesion or some kind of aphthous ulcer. It really does make a difference for people. That's photobiomodulation. That's
Yeah,
encouraging healing. Why would I think that that's not working in the soft tissue? But if
right.
the area has not been debrided well enough, if the patient has, not doing their home care, the way that they should be, then none of that's going to matter anyway.
Yeah, even with I have one of my best friends, um, she works with the pediatric unit in Texas for cancer, for oncology patients, and photobiomodulation, they use it intraorally and it heals
Yes,
tissues and
that's
for
right.
oral mucositis. So,
Yeah,
you guys, there's so much
yes.
possibility behind this. I didn't mean to get off on a laser tangent, but I just
Okay, I love it.
these are questions that I always get, and I wanted to hear your answer on them, and they're very similar to mine, but I love how passionate you are, and you bring in the DNA and the RNA and the healing aspect of that and what it's targeting, because if you're thinking about even the color of the tissue, that's what the light is attracted to
Yeah,
in the laser and what
yeah,
it's targeting, so
that's
thank
right.
you.
You're welcome. My pleasure. I love it. One of my
Yeah.
favorite topics.
So how do you get into I always have to ask, I love a good story, I love a person's story, so you went from clinician, educator, now with young. How did you know you could do all that, and how did that happen for you?
I'm still not sure I can do it, but
Don't
but
stop, stop, you're already doing it great. That's
I
the
I
answer.
I took a yeah, I took different leaps. We if you are blessed to have people that see things in you and you actually listen to them, things can turn out really well for you and can take you down a different path than you anticipated. And that's exactly what happened to me from the very beginning, working in oral surgery and being told, I think you'd be a great clinician, to graduating that and working in perio and being encouraged by the person I worked with that, you know, you would do really well. I think you do well working with lasers, or maybe you might be interested in this technology, and getting exposed to these different things and getting that passion. When I stopped working clinically full time because I couldn't physically do it anymore.
Mm,
Last 10 years was scaling and root planing, every day, all day, and as much as I loved it, my body didn't. And no, I was not paying close attention to my ergonomics. I mean, there's some things that we can do, um, and then there's some things that you have to be very conscious of,
yeah.
that you're doing, because I'm just gonna do this one time, right? This one spot, because I gotta get moving, and then all of a sudden you've spent 10 years doing that. So you have to be super aware, um, and, so anyway, that happened. So it became a point where a long week, I would be sore on Friday, and then it started getting shorter and shorter and shorter, and all of a sudden I found that, like, every day I was just in pain. So I had started doing some speaking and presenting found me. I didn't go looking for any of that, which always made me feel a little bit like imposter syndrome. Like I'm not supposed to be in this sandbox with these kids because, I didn't work hard enough to be here. But I found that people were interested to hear what I was doing and how I was treating my patients. And that's how I started speaking and kind of moving out of my circle outside of my little state, and meeting people online. And one of the people that I met was Amanda Hill, and she was stepping away from this role to explore making her speaking and presenting career larger. And I saw this job opportunity with Young, her position, and I sat on it for a good 2 or 3 weeks and didn't think that this was a space that I would be able to, um, compete in, if you will. And then one night I remember, text messaging her and saying, "You know what? I think I'm gonna throw my hat in the ring." And I did, and that's, the rest is history. Um, I do have to, full disclosure, I do have a master's degree in business, and that's something that I started, 16 years ago is when I received that, because I could tell that my body wasn't going to let me do this forever. I had started to get pangs, and I had seen other people needed to make shifts out of clinical hygiene, and I thought, well, I need something to fall back on.
Yeah.
So I did an online program, and got my master's in business. So I'm sure that was part of what attracted, Young to interview me as well. But
This goes on the story too of people saying, "Should I go ahead and get my degree in this or that?" Yes. If you're
Mhm,
thinking about it, do it because you
mhm.
never know. Well, 1, if it's on your mind, do it.
Yeah,
Time's gonna pass either way, right?
exactly,
And you are going to
exactly.
look back and say, "Why didn't I do that? What in the world? I'm too old now," is what, people always say. I'm like, "You're 40, you have a lot of life ahead, or you're still 50, you have a lot of life ahead, come on." So
That's right.
just wanted to interject there. So you did that. You got your degree, and now you're with Young, and you're doing other things too.
Yeah, yeah, I do lots of I wouldn't recommend people doing that the way I did it because I remember, waiting as our son is adopted, and I remember we making this decision that that was the road. I always knew that was the road I wanted to go down. I mean, I grew up in the '80s with all the, Feed America stuff and all of the ads that you saw on TV, and I was like, "This is, part of how I wanna build my family." And so, my husband and I decided to go down this road, and I thought, "Well, I'll get my master's now." 'Cause, I'll be home for 3 months, it'll be good. I mean, what else am I gonna do, right? I'm gonna be home with
Else.
this kid for a little while, so I'll get jump start on that. That wasn't very smart. You don't know till you know when you have kids that it's not just, like, naps and, nothing.
Uh-huh.
So, but,
That's glorious.
so I do, I work also do a little work with, Dave Striegel, who, is, Striegel Performance Coaching, Coaching Excellence. He's out in California, and he's a really neat person, working in historically in the sports, sector and sports psychology and things of that nature, and bringing those kind of team dynamics and into the dental world. And so I've been doing some work with him, working with some of, the goals that he has for hygiene in the offices that he's coaching. So yeah, lots of things, doing lots of stuff.
So, Nicole, what I'm taking from what you're saying too, and what I pick up on throughout everything I'm doing is it doesn't look a certain way. Like, people have it in their mind that it looks a certain way when you do certain things. Like, they may think, if
Yeah.
I wanted to work for a corporation, that I can't be doing these other things as well. You can.
Mm. You
And
can.
it's up here with limiting beliefs, so start to question where those beliefs come from and if they're real, and you don't have to be mutually exclusive with what you're doing. You can do this and that and that and that and that.
Yeah.
So that's what I wanted to encourage people also from your story, because you're still doing it, and
Mm.
you even said you're like, "I'm not sure how well I'm doing it," because sometimes when you're in the middle of it, it's a learning process, and
Yeah.
it's imperfect, and,
Yeah.
for a person who wants to do their best and who wants to grow more, it's an eternal process,
Yeah.
isn't it?
Yeah. Yeah, totally. Absolutely. And absolutely. You don't have to limit yourself. You can do as much or as little as you want. You'd be amazed at how certain things can kind of fill your desires. So my missing clinical piece of things, I'm able to actually talk with my students and impart some real world wisdom, if you will, and
Yeah,
encourage them, and that satisfies that for me. There are different ways that you can fill those interests that you have. It doesn't have to be just one thing, for
right.
sure.
Yeah, it can be slices of 20 different things, so just wanted to encourage everyone with that.
That's right.
Nicole, it has been such a delight having you here, and if you wanted to get more information on Nicole and what she's doing and all the things that she's doing, her contact information is in the show notes below. Nicole, any final words? I could talk to you forever.
I know, I can't believe it. The time's gone by already. I feel like we just
We
just
did.
we just
We have to have a part
started.
2. We have
I
to have a
haven't even
part
told
2.
you my best stories yet. No. No final words other than, listen, if someone wants to support you and wants to introduce another something else for you to do, different ways for you to get involved in things, give it a try. The worst thing that can happen is you'll hate it and you'll step away from it, and that's no big deal. Things will work out, but don't be afraid. Just don't be afraid to try something new, to put yourself out there, um, because it can work out really nicely.
Yeah, and better than you can ever have imagined it.
Absolutely.
Right, is what I found. It's just like, "And better, and better."
And better.
Not this or that, it's "and better."
That's right. That's right.
Yeah, well, thank you again to all of the my listeners. I always ask to go on to Apple Podcast and to give the Dental Handoff a five-star rating, and go on over to YouTube if that's where you're watching it now, that's cool, and click the subscribe button and the little ring button too, so you are notified when there are new episodes that drop. Thank you for all that each of you do every single day to serve your communities. We will see you next time. Thanks, Nicole.
Thank you.